again. All is right with the world. Tom Brady won another Super Bowl. Wasn't with our Patriots, but still I was very happy for Mr. Brady on that victory. I also want to once again thank Dr. Mark Kerouac, the President and CEO of Bayside Health Systems, and also congratulate them on their continued investment here in the city of Springfield. The Hospital of the Future continues, $208 million of expansion, and we deeply appreciate that. And Dr. Robert Roos of Mercy Hospital, Trinity Healthcare, we are very, very lucky to have two first-class medical health establishments right here in Western Massachusetts, and we really appreciate that. And I want to thank Patrick Leonardo, the Director of Operations for AMR. They have been a fantastic partner in the processes of testing and vaccination, and Patrick, we deeply appreciate that. And to the media that is assembled here every Monday morning, I deeply appreciate TV and print and radio for getting this information out, and to our sign language professionals, thank you very much for being here. We appreciate that. And of course, to my cabinet heads, down the rank and file, and their families for their continued and dedicated efforts. They've been tested and true through a number of natural and man-made disasters, and we're going to continue to move to defeat this COVID-19. Let's go into the stat sheet. Total confirmed COVID-19 cases since this ordeal has started, 16,217. The weekly number, which includes the last day of January, is 638. The monthly number, which is not including a couple Sundays, is 553. Our VAX force will be meeting again this Tuesday with Commissioner Helen Carlton-Harris and a diverse group of individuals we put together, which is going to be very helpful in dispelling misinformation and getting out correct information on the importance of getting this vaccination. Unfortunately, we had 7 new deaths. This dates back to January 30th. Total deaths now in Springfield residents are 199. And again, our thoughts and prayers and sympathies and encouragement go out to the affected families. The breakdown goes like this. White is now 82 at 41.2%. Black is at 45 at 22.6%. Hispanic is at 66 at 31.1%. And Asian is at 6, which is 3% flat. Long-term care facilities and deaths, again, that has stayed very stagnant, which is good, 58. That's going on a few months at 29.1%. The majority of increases residential, 141 have passed. That is 70.8%. The Stop the Spread with Governor Baker and AMR will continue at the Eastfield Mall. Again, they're doing hundreds, if not thousands, of people a day, and I want to again thank Governor Baker and Pat Leonardo of AMR. Commissioner Helen Carlton-Harris and I, working with State Representative Bud Williams, we're going to stand up some neighborhood sites starting this week. Mason Square, Rebecca Johnson, Putnam Vocational Technical High School, and we're also, in the Old Hill, we're also looking to stand up a site in the Orchard, possibly targeting Kennedy Middle School. The mass vaccination site continues at the Eastfield Mall through Governor Baker. I want to let you know that we put together, Helen and I put together when our seniors were in need of trying to navigate through the registration process. Our libraries, health department, and the senior center, Raymond A. Jordan Senior Center, they have handled, since we put that together, I believe last week, over 1,600 calls of assistance. So I'm very proud of that outreach. I'd also like to thank Sheriff Nick Cochi, who's also put together an assistant line to help out our seniors. I appreciate that, Nick. And again, Governor Baker announced late last week the 211 line, that's a state line for assistance. Our senior citizens to home delivery of meals continues, and I appreciate that. Governor Baker has lifted restrictions on capacity for businesses and restaurants. They now can go to 40% capacity. But you still, for indoor, residential and other activities, 10. It still stays at 10 inside, 25 outside. We received a couple of calls from condo and apartment complexes from individuals indicating that there are some individuals going in common areas of those establishments, condos and apartment complex areas, not wearing a mask. So I know Commissioner Carlton Harris will be reaching out to a couple sites, but to the management of the sites, apartment complexes and condo complexes, common areas, please let your residents know that they still do need to wear masks. That's extremely important. City employees, I want to thank the city employees. Well over a $600 donation was made to the Food Bank of Western Massachusetts. This is on top of the thousands of dollars we were able to bring from the business community for them. Next week, because of President's holiday, which is Monday, we will be holding our COVID-19 city hospital update due to the President's Day holiday. Will be held on Tuesday, February 16th, not Monday. Conversations with the Congressman Neal, Chairman Neal, Ritchie, updated me on the federal stimulus, and it seemed, obviously, the checks seem to be move forward. There's a strong push to get money to state and city entities, which would be very helpful to us, and of course the PPPs for businesses, and also monies directed at schools. Speaking of schools, we had another last week and evening of Springfield Empowerment Zone meeting, school board meeting we had on the updates there. This Friday we'll be celebrating President's Day, George Washington statue at the Holy Name site on Dickinson Street. President of Daughters of American Revolution, Holly Blair, does that faithfully every year, so thank you, Holly. And this is an important announcement now. It's Valentine's Day this weekend. So each and every one of you out there, don't forget your special Valentine. We did another small business, Buckeye Smoke Shop, Harry's Cafe, the Glantz Brothers, 30 years in business at the corner of Wilcox Street and Main Street in the South End, and we did a proclamation, and again, they've been a haven not only for great cigars, conversation, and coffee, but they've been a standout for the South End neighborhood for many years. I want to thank MGM, been a very good corporate citizen, and assisting AMR. They've donated that heated tent out there and are feeding the AMR members who are out there in the cold many a times with meals. We continue our Oasis Food Bank with John Foley, Sedesco, and the Food Bank of Western Massachusetts on Fridays at Central High School. We're serving well over 3,500 families each Friday. Briefly, before I again bring up Dr. Kerouac and Dr. Roos for their presentations, and they will take questions after their presentation so they get back to their important duties at their medical establishments. Deputy Steve Kent is representing Commissioner Cheryl Clapprood today. Indicates it was a quiet weekend, which is good. They're down 4 with COVID. Those are much better numbers. Our meetings continue, weekly meetings continue with the Department of Justice. Commissioner Calvi indicates on the fire department, they're down 6 with COVID. He'll speak to you about ice safety. They had a really nice article on the rescues they do on ice, God forbid. And he'll also speak to you about clearing out your hydrants, fire hydrants. Superintendent Dan Warwick, meals, we're nearing 6 million meals served to our students and families. Breakfast, lunch, dinner, and snacks. The actual tally is 5,969,980. They put out over 102,456 for the weekend. They continue retrofitting of our schools for better ventilation, higher standards for the COVID-19 above what's been recommended. Continues with Pat Sullivan. He'll speak to you about attendance, which continues to hold strong at 92.1%. And I know Helen Carlton Harris is very, very happy. She was very instrumental in making sure we got all our student athletes tested and coaches. And this is a testament to the Springfield School Department. 221 tests were rendered, 0 positive. So that's a testament. So sports is back in the swing of things for the winter months. DPW Director Signoli indicates he's down 2 with COVID-19. He will give you an update. We just had a storm. We seem to have other pending storms coming. He'll update you on the snowstorms. Another traffic light or controller is down. Director Signoli, that's at Union and Oak. They're working on it. It's blinking now. But since September, car accident now. Since September, 6 of those units throughout the city have faced damage. And it takes quite a while to repair them. Not only would our repairmen who do a great job in all types of weather, but many a times parts have to be ordered. I also want to thank Director Signoli and Pat Sullivan, working with the McKnight Neighborhood Council, Liz Stevens, the Highland McKnight Rail Bike Trail to East Forest Park is moving forward. Finances, since this ordeal has started, $7.5 million in deficit. I'm down about $2.6 million for FY21, reports my CAFO, TJ Plant. We've reached the $30 million mark being spent, deficit spent in grants. Of that, 7.8 million is deficit. 22.2% we've been able to pawn off on grants as we continue to balance that. Starting our FY22 budget, the internal budget sessions this week will start as we prepare our budget for FY22. Facilities and parks, Director Pat Sullivan indicates to me he's down 1 with COVID-19. His team has done a great job continuing to retrofit our schools and our buildings for top-notch, above and beyond ventilation to defeat this COVID-19. He continues to work very closely with Commissioner Helen Carlton Harris and Superintendent Warwick as we are very hopeful. We're scouting out logistically vaccination sites, mini vaccination sites for our neighborhood areas. We're just, knock on wood, we're hopeful if we can get a supply, that's what I'd like to do, as we've done with testing, be able to take out and do vaccination sites in neighborhood areas. In the meantime, you have to utilize the mass site at the Eastfield Mall. But again, if we can get our hands on supply, that is our intent. Pat, also the regreening, Springfield trees, more trees being planted. And again, I mentioned about the McKnight and the Highland Rail Trail, Bike Trail. I want to thank Representative Pupolo and Representative Williams for shepherding that through the legislature. We're also trying to be, again, customer service driven, constituent service driven. And I want to thank Pat Sullivan and Attorney Bill Mahoney. Temporarily, we're looking to put in a lock-up window, City Hall, in our horseshoe for March. It's a heavy time of bills being paid, excise taxes and other things being paid, for the convenience of our customer base and constituent base. So stay tuned, an announcement will be coming on that. It'll be pretty cut and dry, so that way you can simply walk up to the window, do your business. We'll have tenting out there and trying to make it as convenient as possible, and also to continue to protect and preserve our city workforce and continue to protect and preserve the residents as far as the proper distancing. So stay tuned on that. Economic Development Chief Development Officer Tim Sheehan, nobody's down with COVID-19, which is good. He'll continue to give updates as he monitors our federal and state stimulus packages. Also, he'll indicate to you on state, Governor Baker, grants that came out. A number of Springfield businesses that we have helped out locally here with the city have also received now grants from the state. We're very appreciative of that. The housing market, Director Sheehan indicates to me, is holding strong, continues to rise, 17%, up 17% again. And the median house is about $210,000. Law, HR, and Labor, Solicitor Pakula and Attorney Bill Mahoney. Law Department's down 1 with COVID. Attorney Mahoney updated the U.S. unemployment rate has declined from 6.7 in December to 6.3 in January. So majority of indicators point to that we're starting to move in the right direction. It's not over yet, but the swan song we're hoping is going to come very soon. But we have to continue to stay vigilant. And I think it's important that you listen to the medical information from the experts, Dr. Kerouac, Dr. Roos, and Helen Colton Harris. But again, I thank each and every one of you that are viewing us, the residents and the business community, for your cooperation, your collaboration, your patience in working together to defeat this COVID-19. Without further ado, I'll bring up the President and CEO of Bay State Health Systems, Dr. Mark Kerouac.
Good morning, everybody, and thank you, Mr. Mayor, as always, for these opportunities and for the collaboration with your team. So the rate of COVID-19 has continued to decline across the country, across the state. The United States now has over 27 million cases, 460,000 deaths. However, daily new cases have been below 150,000 for more than 10 days. New cases on Saturday were 104,000, and yesterday only 88,000. First time we've been below 100,000 in a long time. So clearly the virus, in terms of new cases, is going down in the country. Massachusetts is now close to 513,000 cases, over 14,600 deaths. But again, new cases have been steadily below 4,000 a day these last few weeks. Hospitalization numbers are down about 30%, 1,450. That's from a high of over 2,200 a few weeks ago. And the test positivity rate, which is our leading indicator, continues to go down, 3.1%, one of the lowest figures we've seen in many months. And that, I believe, has been what led the governor to relax many of the restrictions last week. Hambden County is seeing declining cases, but not quite as fast as the rest of the state. As a result, we are second highest in the rate of new cases per capita, 61.9 per 100,000 population versus Bristol County, Fall River, New Bedford area, 65.7 per 100,000. So that tells us there's still a lot of virus around, and people should not take comfort from the fact that rates are declining. Bay State Health actually saw a slight uptick from last week, but we're still well below the level from around the holidays. Today, we had 125 cases across the system, 105 in our Springfield campus, 20 in our community hospitals, and only 10 in critical care. Our test rate also has been falling 5.6% most recently. That's the lowest it's been since November. So we expect that case rates will continue to fall in the coming weeks. I wanted to say a thing or two about the value of monoclonal antibody therapy. Many of you remember a few months ago when President Trump had his illness, he got access to an experimental therapy called monoclonal antibody therapy. It is a synthetically constructed antibody, which is very similar to the kind of antibody people get when they get vaccine. And it causes virus rates to go down fairly briskly early on in disease. It's clearly superior to the plasma treatments we were using earlier in the disease. You'll recall I said in 2021, we're really not going to be talking much about plasma. We'll be talking about monoclonal antibody. Here's the tricky part, though. Monoclonal antibody is most effective for high-risk individuals before they get sick. So people over the age of 65 with multiple chronic diseases, etc. You can reduce the likelihood that you're going to get sick enough to go to the hospital by more than 50% if you get an infusion of these antibodies. However, when people aren't feeling sick, they're not thinking about this. And as a result, in our area, we're giving much less of this than we really ought to be. And I'd like people to be thinking about this. We're going to be doing our best to reach out to patients who test positive, who are over a certain age, to let them know that this might be a good idea for them. It's a real win-win. It turns what could have been a severe case into a mild case, and it reduces the amount of burden on the hospitals and the healthcare system. So if you test positive for COVID-19 and you're over 65, or have multiple chronic diseases like diabetes, high blood pressure, obesity, definitely talk to your doctor about monoclonal antibody. Also wanted to say a word about these variant viruses that are in the news. These are now being tracked much more regularly in the United States these days. There is a British variant which goes by the catchy name of B.1.1.7. And we now know there are up to 690 cases in 33 states. We know this virus is more contagious than the one we were dealing with over the summer, or the one that's the most common right now. However, it is not any more severe, and the vaccines do appear to be effective. Based on its rate of rise, it's expected to become the dominant virus, in other words, outcompete the older one, by March, so that's fairly quick. That's already happened in Great Britain, but it's not affected their ability to get their arms around the virus and to contain it. There's another South African variant that goes by the name of B.1.351. Only 6 cases have been discovered in 3 different states in the United States, so it's really still kind of a rarity. This one as well seems to be more contagious than the historic strain we've been dealing with, but no more severe. It made the news last week because one of the vaccines made by AstraZeneca, which is not yet available, not yet released in the United States, appears not to protect against mild disease caused by this variant in younger people in South Africa. It's not yet clear what protections there are against serious disease in older people, so the vaccine trial has been paused while they try to figure that out. Remember, the COVID virus uses RNA and not DNA as its genetic material. It creates mistakes and variants as it divides and multiplies. Most of these variants are not viable, but a few are. It's not nearly as good, COVID is not, at rapidly changing or dramatically changing the way we know the flu virus does, just because of the way its genetic structure is set up. It is important, though, for us to keep an eye on these variants in terms of their infectivity, their severity, and their vaccine resistance. The vaccine resistance, in terms of what we're looking for, it's most important to watch for severe disease. So very much like a flu shot in a typical year, which might be 50, 60, 70% effective against preventing any disease, including mild disease, it tends to be much more effective at preventing severe disease, and that's what we really need to keep our eyes on. As of right now, this is going to cause us to change absolutely nothing about how we protect ourselves with our public health measures or about our vaccine strategy. Still very early, and I would urge people not to jump to any conclusions until we have more established scientific evidence. It does point to the fact, though, that our ultimate goal in defeating this virus is global vaccination. It does us no good to vaccinate only the developed or the richest countries. Only a fraction of the vaccines that have been administered in some of the poorer countries. And if the virus is churning away, dividing unchecked, new variants are going to be popping up in those areas. And so really our vaccine strategy has to be worldwide. In terms of vaccination at Bay State, we are moving into phase 2, or have moved into phase 2, the initial group being the over 75 group, as you had mentioned, as has been mentioned before. We've administered 24,000 doses of the vaccine. That includes over 5,000 first responders and over 1,200 individuals over 75 in these last couple of weeks. We are opening up sites in anticipation of increased supply. This week, we're opening a site in Greenfield. This will be another one of those green dot sites you'll see when you go to mass.gov. It will only be open on Monday and Tuesday because of limited supply. We also, over the weekend, vaccinated 50 individuals at the Mason Square Health Center and are planning to have pop-up clinics at High Street and at Brightwood, our two other community health centers in inner city Springfield. We are also planning to open sites in the Quabog area, Palmer and Ware, and in Westfield. We also are planning to open a site in Springfield during the week of February 22nd at STCC, and we appreciate their work with us. For all of these sites at this time, we will be contacting our patients who are over 75. So I can't emphasize this enough. Don't call us, we'll call you. As far as our Holyoke site and our Greenfield site, those are open to anybody, but the appointments unfortunately go fast because there just is not enough vaccine to go around. With that said, we're expecting to administer 4,000 doses this week, which is roughly 1,000 up from weeks before, and we hope that that can continue. We believe that we could do 8,000 to 10,000 a week if we were given supply. Because we're aware of the increased risks for communities of color, we are allocating over 300 doses per week for our health center patients. We know that we have 1,500 individuals over the age of 75 who are among our 44,000 patients in our Medicaid ACO, which involves our health centers and caring healthcare. We're working with a number of efforts, including the VAX Force of Commissioner Colton Harris around special messaging for people who have vaccine hesitancy. Also working with the State Department of Public Health around some TV and radio spots about this issue. I think it's important for people to remember the trade-offs between getting the vaccine, which are sore arm and maybe in the second dose, a few hours or maybe a day of feeling like you've got a mild flu, versus the much more serious side effects, sometimes lasting, sometimes fatal, of getting COVID-19. I would urge people to consider that the more people know about science and medicine, that is to say our doctors, nurses, pharmacists, EMTs, our translators, the more excited they are about getting vaccinated. And that's something you should consider. Supply, however, is still an issue. The state is now getting over 100,000 first doses and 80,000 second doses every week. They are expecting increases, and we are expecting the third vaccine candidate, Johnson & Johnson, to pass muster when it goes up in front of the FDA on the 29th of this, or the 28th. It's sometime later this month in any event. That will really help with supply. We're now up to about 20,000 administrations a day. Remember, we need to get up to 80,000 a day if we're going to get to our goal by getting all adults immunized by the end of the spring. Overall, though, allocations are increasing, new sites are opening up, The rules for who gets it are getting relaxed, and we hope to have a third vaccine by the end of the month, as I mentioned. We're hoping soon to move beyond the 75-year-old group into people who have multiple comorbid conditions, or who are essential workers, which is a large group, or who are over 65. And we hope to have good uptake there. We are getting smarter, I think, about how to deal with and convey information about vaccine hesitancy. We're actively reaching out to our Bay State Health patients to assist them in navigating the website or getting appointments. And I was pleased to see the new hotline pop up, the 211 that the mayor had mentioned, as well as the efforts of Sheriff Kochi and of a number of the senior centers who are helping elderly individuals who are unable to navigate or having difficulties navigating the mass.gov website. So if your time to get vaccine comes up, please take an appointment and get a shot. Until you are eligible for vaccine, remember there's still a lot of virus around in Hampden County, even though our numbers are declining. This is no time to relax on public health measures in terms of masking, social distancing, and avoiding crowds, particularly indoor crowds. So I'll end there, and again, thank you, Mr. Mayor, for your kind hospitality and allowing us to come in front of the group each week.
Thank you, Dr. Dillon. Now, without further ado, the Chief Medical Officer of Mercy Hospital, Trinity Healthcare, Dr. Robert Roos.
Well, thank you, Mayor, for your ongoing leadership in hosting these forums for us to communicate, and good morning to everybody. I hope that everyone, all the football fans at least, enjoyed some of the Super Bowl festivities yesterday, and I hope that you did do that safely. I must admit for myself, seeing 20,000 people in a stadium together certainly did give me some pause, but it is important to recognize that there are ways to celebrate all of the different things in our life and festivities in a safer way. We do that, of course, with masks, with keeping distance, and with not sharing indoor space or food with people outside of our household whenever possible. And with that, being said, I also want to extend, before I start today's remarks, with a thank you to the Patriots organization, who did plan out a very thoughtfully event and a safer event that ended up being, I think, a trip of a lifetime for many of our healthcare heroes here in New England. And there were a couple of our colleagues from Trinity Health of New England who were selected to be part of a trip to go down and watch the Super Bowl yesterday. Matthew Bluen, a nurse from St. Francis Hospital in Hartford, and our own Sherry Rodriguez, a respiratory therapist at Mercy Medical Center. They were part of a select group that were fully vaccinated and masked and distanced and flew down to Tampa Bay on the Patriots plane as one of the healthcare heroes here in New England. So thank you to the Patriots organization and Robert Kraft. It was certainly not a typical situation, but one that was well deserved for people that have been the true heroes throughout this year. As it was discussed last week and also again today, fortunately the trends that we've been seeing in terms of the numbers of new infections, hospitalizations, and deaths due to COVID at a national, state, and local level are continuing to move in the right direction. The rate of decline of the average number of new cases across the country has been the steepest and most significant since the beginning of the pandemic. It has dropped actually over 50% since the peak on January 8th here in the United States. Hospitalizations have decreased by over 30% during that same time period, and the number of deaths, of course, far lower than they were at their height, over 4,000 per day previously. In Massachusetts, that trend has been similar. As discussed, the average number of new cases per day has dropped and is about 70% lower than the peak was on January 8th as well. The hospitalized cases down to under 1,600, 35% lower than the peak. And we have been under 2,000 hospitalized cases per day now for the last week, which is the longest it's been during any stretch since before the Christmas holidays. At Mercy Medical Center, we have seen a declining, although it's been very slow, number of hospitalized patients over the last week. So it may be a bit of a plateauing. As of this morning, we have 22 hospitalized patients with COVID, and we do have 6 of those in our intensive care unit. So only down a little bit from the 24 that we had last week. Our test positivity rate at Mercy does remain higher than the state average. It remains at 7%, which is largely due because of the fact that we're not doing as much broad-based screening perhaps as some other areas and some other testing centers throughout the Commonwealth. But it has significantly come down from what was back up to 13% pretty regularly about 4 to 6 weeks ago. So we are still seeing that and are encouraged by all the trends that we're witnessing at this point. It certainly is showing that we are seeing the impact of a successful vaccine, as we are seeing less hospitalized cases and less deaths. But it is still notable to be reminded that where we are now in terms of total numbers of cases per day, hospitalizations and deaths is still far above across the country where we were even at the peak of our first and second waves. 106 million infections across the globe with 2.3 million deaths, more than 27 million infections here in the country, and over 460,000 deaths. We still do have one of the highest cumulative case rates in the United States and one of the highest death rates per population. And as Dr. Kerouac mentioned, the new variants that we've been talking about for the last month or so are still something to keep an eye on. Certainly not something to raise significant alarm, but something for further investigation. This weekend, a study was published, not yet peer-reviewed in a journal, but researchers in California did report that they are seeing evidence that the B.1.1.7 variant that is found in the United Kingdom, there is evidence that it has been doubling at a rate of about every 10 days. It's a very, very small sample of positive cases that were looked at from December into January. But it does at least confirm that the modeling that the CDC did several weeks ago puts it on pace to be the predominant strain here in the United States in March without any other major mitigating efforts. It was also mentioned the decision on behalf of the South African government to pause the use of the AstraZeneca vaccine as they continue to look at the effectiveness of that vaccine against the strain that is found there, B.1.357. And so all in all, there is still a lot that we don't know about the variants. There's a lot that we must continue to look into and investigate. But more than anything, the message remains, and I completely agree, for us all to just continue to maintain our caution, to adhere to our public health guidelines that are effective against any of the strains of coronavirus, and most importantly, continue to escalate and push for a quicker vaccine campaign. By all accounts, the vaccines are safe, they are effective, and they are, right now, reducing moderate to severe disease. And that is the outcome that we are most interested in. Across the country, we've administered about 42 million doses of the 60 million that have been distributed. When you break that down, it's about 32 million first doses and about 9.5 million people have received both. That's about 11%, 12% of the population across the country having received a dose, and about 3% or so that have received both and are fully vaccinated. Of course, we know there are millions and millions of other people that have some level of natural immunity due to prior COVID infection. And as the vaccination campaign has been focused on those that are most at risk, this is accumulating evidence that it is a contributing factor, certainly to the positive trends that we've seen over the past several weeks, particularly in the reduction of hospitalized cases and deaths. From a country perspective, the countries that have had the most robust vaccination campaigns, Israel is often cited as an example, have seen pretty dramatic declines, even in the weeks following vaccination for specific age groups of individuals. And so here we must just continue on the path that we have set and escalate it as quickly as we can. The good news is now that the Johnson & Johnson vaccine is being reviewed by the FDA, and there will be a decision later this month, we should expect to have another vaccine available here in March and with increasing production in the months to follow. Both Pfizer and Moderna are also looking at ways that they can increase production, which would be very helpful by perhaps adding more doses into each vial or by bolstering up production in facilities. And here in Massachusetts, we've started to see the rate of vaccination pick up, a promising sign. As of yesterday, about 755,000 doses in Massachusetts had been administered, tracking very closely now to the overall national rate, about 11% of people having received a vaccine and probably a little over 3% now fully vaccinated. The number of vaccines has gone up, as was mentioned, about 150,000 per week or 20,000 per day. And right now the state is really going to be focusing on ensuring that sites that are able to utilize a high percentage of the vaccines given to them will be the ones to receive more. And if there are sites that are not utilizing as much vaccine, that it will be, the distribution will be shifted to those that are using more than 85% of their vaccine each week. So we are in a period now where the infrastructure is starting to expand more rapidly. More sites are opening up, more appointments are opening up, and the focus is really going to be on getting more vaccine supply to match up with that infrastructure so that we can really push and accelerate the campaign. We are continuing to vaccinate individuals that are in phase 1 or those in the first category of phase 2, meaning individuals 75 or older. We are still waiting further guidance from the state regarding when and the timing of we will move into additional categories in phase 2. At Mercy Medical Center, we have now provided over 5,300 vaccinations. Over 1,700 individuals are fully vaccinated. We schedule about 800 to 1,000 per week, both accounting for first and second doses. And if you are eligible in one of the categories in phase 1 or somebody who is 75 or older, you are able to look for available appointment dates and times online at any time now at www.trinityhealthofne.org/mercy-vaccine. We do have some available appointments each day over the next couple of weeks, but they do fill up quickly, so I encourage people to check very soon. You can also go to the Department of Public Health's website at www.mass.gov/vaccine to find out not only if you're eligible and sign an attestation, but any other sites that may have availability in the near future. So at this point, it's clear the evidence is starting to accumulate. This is a very exciting time. There is evidence also that the vaccines may not only prevent serious illness, but start to slow down the spread of the coronavirus. But we don't yet know enough about that, and the science is not yet conclusive. So at this point, if we want to get to a place in the summer or perhaps the fall or even at some point before 2022 where we have full capacity stadiums, where we have restaurants and businesses operating at 100%, the time is still now to be safe, to remain vigilant, to mask, to physically distance, and avoid gatherings. It's only with us doing that together where we will be able to realize that reality again in the future. Thank you.
Thanks, Dr. Russo. Dr. Kerouac and Dr. Russo take questions from the media. I know 22's here, Mike Garrett, Paul from radio. Any questions, comments from Dr. Kerouac, Dr. Russo? Paul?
Are you getting more supply of vaccines now than you were a few weeks ago? And how far in advance do you know how much you're getting so you can, book appointments, and as you said, now you're going to start calling people regular facing patients. So how far in advance does this work to know what you're getting?
It typically for us has been a week-to-week thing to know how much we're getting. We usually overbook appointments, assume we're going to get a little more than we got the week before, but oftentimes we'll have to call people and say, we're sorry, we can't honor that appointment. So it is still kind of an in-the-moment kind of thing, and it would be nice to get a steady supply, which was at the maximum that we could distribute, but we're far from that right now.
So how far? So you are getting more than you were?
Yes, we're getting between 2,000 and 3,000 doses a week. We are able to do 1,500 to 2,000 doses a day, so that would be, 8 to 10,000 a week. And so if we knew that we were going to get 8 to 10,000 for the next 4 weeks or 6 weeks, we could really do a lot of creative things because we're planning a number of new sites. And we understand that the major issue there is the federal allocation.
It is a different scenario for us where we don't have the excess capacity and are looking for more vaccine to bolster that up. The change has been early on where we set a capacity for ourselves of about 1,000 a week, which really hasn't changed. We weren't sure early on if we were even going to get that. Now the communication and the process of request and delivery has been much more transparent and supported. So we will generally get word the week prior that we will receive the vaccine for our full scheduled appointments for the following week. So it's been improved, and at this point we aren't asking for additional vaccine other than what our capacity is.
Any questions or comments?
Dr. Travers, I'm curious, there's been some reports in both from Ontario and Israel that there's been a rising number of younger people that have been showing up in the hospital. I suppose perhaps as a counterbalance to a certain extent of the decline in older people. I realize you don't have a huge sample of patients to go off. Are you seeing any increase in that, such as we are engaging in the large-scale vaccination at this point as well?
I'm not sure I have good information about that. I'm trying to think of what I've learned. Certainly in the last month or two, the average age has gone down somewhat. And you'd expect that as we vaccinate more and more individuals in nursing homes and more individuals over the age of 75. I think the important thing for people who are younger is that it can be a very serious disease. We just a few weeks ago discharged an individual from our hospital who had been with us since Thanksgiving, who was only 40 years old. And so it can be a devastating illness that can leave you with months and months of rehabilitation and chronic symptoms. So this should not be taken lightly as something where a young person can not worry about protecting themselves, because it really is a kind of Russian roulette situation.
I would just concur with that. When looking at our experience, we have always had some patients hospitalized that have been in younger age groups, 30s, 40s, 50s. All that has changed. I don't think the absolute numbers of those younger people has gone up. I think all that's changed, to Dr. Kerouac's point, is as we protect more and more of the elderly over 75 and in other settings, the proportion may shift a little bit, but the overall numbers of hospitalized cases are going down accordingly.
Any other questions or comments? Okay, hearing none, I really appreciate Dr. Kerouac. God will thank you and all your team's efforts, and stay healthy, you and your family. We'll now get our weekly update from the Commissioner of Health and Human Services, Helen Carlton-Harris. Teamwork, see?
Thank you very much, Mayor, and thank you, Deputy. It does take teamwork to make the dream work, and so I appreciate your helping me with my slides. So thank you very much, Mayor Sarno. We want to I want to start by thanking Bay State and Mercy Medical Center for their partnership through this COVID-19 pandemic, but also what they're doing locally to make sure all of our residents are informed and up to date. So thank you to both of those amazing hospital systems. I'm going to start with the confirmed cases of COVID-19 in the city of Springfield, January 31st to February 6th. Sunday, there were 85, Monday, 155. Tuesday 65, Wednesday 44, Thursday 109, Friday 76, and then Saturday 104. The age groups, 0 to 10, we had 55 cases last week, 11 to 20, 101, 21 to 30, 127, 31 to 40, 92, 41 to 50, 103, 51 to 60, 78, 61 to 70, 40, and 71 to 80, 27, and 81 to 90, 13, 91 to 100, there were 2. 75% of the cases from last week were under the age of 50. 25% were over the age of 50. That number has remained pretty consistent throughout our data reporting for our COVID-19 cases. We continue to ask our residents under the age of 50, particularly under the age of 40, where, as you can see, there are 44% of the cases. So the younger ages are still presenting at COVID-19 at increased levels compared to the rest of the age groups in our population. Now going to look at the confirmed COVID-19 cases for the past 6 weeks. And I will start the week with the week of January 10th. Compared to the prior week, which was 1,177, that week we saw 134 less cases. The next week there was 952. We saw 91 less cases. The following week, the week of January 24th, there was 911, which was 41 less cases. The week of January 31st, which was our last reporting week, our cases went down 273. So I want to stop there and really say that is great progress for us. We want to continue to see that kind of progress across the city of Springfield and the Commonwealth of Massachusetts. But having a decrease of 273 cases really is something that we are celebrating, but we are not satisfied. And so we want to make sure that individuals continue to do what we've asked to do, which is wear your mask, watch your distance, wash your hands, and please avoid large and small gatherings. Obviously, there were Super Bowl parties, I'm told, over the weekend. Although the Super Bowl parties were not at the magnitude we're used to in the past, there were some gatherings, and it is our hope that over this past weekend, individuals took the precautionary measures to stay safe, because we want to continue to see a decrease in our numbers. And so looking at the numbers by month, in January, there were 4,342 cases, which is 154 cases less than we saw in December. In February to date, there are 553. Let me make sure that I'm thanking my fact checker, Bill Baker, for helping us to make sure we had the accurate number at the 553. Thank you for the communication director for the city of Springfield. We want to look at the zip codes now. In 01101, there were 3 cases. 03, 4 cases, which is 1%. 04 had an increase of 1%. There were 120 cases in 04, which is 19%. 05, 63 cases, 10%. 07, 56 cases, 9%. 08, 94 cases, 15%. 09, 157 cases, which is 24%. Let me back up and say that in 08, we saw a decrease of 4% in the cases, and in 09, we saw an increase of 4% in the cases. 1-8 had 35 cases, 5%. 1-9, 62 cases, 10%. 2-8, 11 cases, 2%. 2-9, 14 cases, 2%. 5-1, 19 cases, 3%. In our race and ethnic breakdown, at this point, Black African American of last week was 14%, Latinx 24%, white 32%, and our unknown cases were 27%. Again, unknown is when there is no race or ethnicity that is on the form for us to pick that data up. So overall, in terms of our cases, we are pleased once again that we're seeing some decrease. Hope that trend continues. The mayor has told you that there were 7 deaths that we reported from January the 26th to January the 30th. This data is from January until January 30th. There was a 58-year-old white male that we lost, a 62-year-old Black female, a 75-year-old white male, an 80-year-old Hispanic male, a 63-year-old Asian male, a 91-year-old white female, and a 78-year-old white male. It is always important that we pause to say that these individuals were lost to COVID-19, which we believe is preventable if we all do our part to try and take care of ourselves and the mitigation efforts that we have put in place. I am, along with the mayor, extremely proud of the system that we have set up to support the elders in the city of Springfield. The libraries took 421 calls last week to assist our seniors. Health and Human Services, 616 calls to help our seniors, and Elder Affairs took 612 calls to help our seniors. 1,649 individuals over the age of 75, and that's important, were assisted by the staff of those 3 departments. The mayor has mentioned Sheriff Kochi, and I'm sure that there are others. We're pleased that the governor has set up a line where individuals can call. However, it's also important to recognize the teamwork that we have in the city of Springfield. While we appreciate guidance from the Commonwealth, we do not hesitate to take leadership when we know that we need to put systems in place in order to support our most vulnerable citizens. And I thank the mayor for his vision and for helping us and our seniors to move forward as far as they getting vaccinated is concerned. Vaccine distribution, the Department of Health and Human Services will begin our second doses of the 1,400 individuals that we have vaccinated. That will begin tomorrow. It's important for me to say, this is only for individuals who have received their first immunization from the department. We will have a list of individuals that we have vaccinated. We'll be checking. I have gotten phone calls from individuals who are asking if they can come and get their first vaccination. That answer is no. We will not be vaccinating anyone for the first time. This will be second dose only. What we do believe is that vaccines is going to take a collective effort. The hospitals, health departments across the state, everyone, our health centers have to be involved in this effort if we're going to get the population of the city of Springfield and the Commonwealth vaccinated at the rates that we know we need to in order to achieve herd immunity. And so we particularly want to encourage the Commonwealth to set up vaccination sites in communities of color where we know the prevalence of the virus has been hitting the hardest. And so it's important that Eastfield Mall and other mass vaccination sites be set up, but it's also important that we have vaccination sites that are local and centralized. The mayor has made an offer and has said, I know, to the administration at the state level that we are ready to do smaller vaccination clinics. We will not be able, because of capacity, to do large ones, but we do believe that on a rotating basis, we can reach neighborhoods along with our health centers. And so we promote and ask that communities of color and those areas in our city where we have a high poverty rate be prioritized and be considered as we get additional vaccinations. VaxForce is meeting again tomorrow, but we will have students from Western New England and UMass who will be observing our vaccination process as we move forward. They are excited. The students want to be a part of our effort. So I'd like to thank Dr. Sarah McAdoo, who is bringing a student, and Dr. Madison from Western New England, who is also coming and bringing students. It's important that we do educate all of our students around the vaccination process. Teachers, I have been asked, and I'm going to make this statement just saying what I believe, and that is that teachers are essential workers. We have talked about wanting to get our students back in school, and we know that the data across the country is telling us that teachers should be able to go back into the classroom safely without being vaccinated, and that is probably true. But the question becomes, how do we make our teachers feel as if they're valued and can do their job safely? And so I hope that teachers will be prioritized as we move into that next phase, along with funeral directors who we know are picking up bodies and who are in hospitals. I also believe that we should give consideration to making sure that our funeral directors have an opportunity to be vaccinated. AMR, our partner who we'll be working with all week at Bowling School, has tested 136,855 individuals. Of that, they've had 12,921 positives. They also have tested 58,831 Springfield residents. They have testing sites that they're considering. Obviously, we talked about Rebecca Johnson, Putnam, and we are working to think through a process for Kennedy. They are testing at Friends of the Homeless and New North Citizens Council. And so it's important to say thank you to those agencies, organizations, and entities who step out front and say, we will help you, we will work with you, we will be your partner. So I cannot thank AMR enough. The Springfield Public Schools, our student athletes, coaches, congratulations to A.D. Early, Assistant Superintendent Lydia Martinez, also Jeannie Clancy, the nursing supervisor, and of course the superintendent, Dan Warwick. 221 individuals tested with 0 positives. That is absolutely amazing. And that doesn't happen by accident. That means that the staff is taking the time to make sure that those students are staying safe while they are playing sports. So again, thank you to that amazing team. I am very, very impressed and grateful to you. Finally, I'll say that yesterday was National Black HIV Awareness Day. It happens the first Sunday in February to coincide with Black History Month. Usually, if it was not COVID, we would spend time with Mayor Sarno in this room celebrating and talking to and about those individuals who are HIV positive or have an AIDS diagnosis. We're not doing that this year because much of our focus is on COVID-19. But I want to remind us all that the HIV/AIDS epidemic is not over. It continues to ravage families. Individuals continue to get sick on medication. It is not the fatal disease that we dealt with in the 80s and 90s. People aren't dying at the same rate, but people continue to be infected by this virus. And so this year's theme is Let's Stop HIV Together. And I do think that it's very important that we understand that on some levels, coronavirus has taken over much of our public health systems. We're still dealing with an opioid crisis, mental health disorders, substance use disorders, gaming in terms of individuals addicted to gaming. Nursing is still dealing with tuberculosis and other communicable diseases. Environmental health is still having to deal with all of their work. Recreational marijuana is a challenge for some of our young individuals, and gun violence. I say that because these public health issues have not gone away, even though COVID is here. And I just want to make sure that as we think about National HIV/AIDS Awareness Day on February 7th, that we certainly understand that there are a realm of public health challenges that continue to face us. We will be here to try and provide information, and the department, my department, Health and Human Services, continues to do that. So I want to thank the Department of Health and Human Services. I want to thank our nursing staff. Thank you to AMR. Thank you to the cabinet of the city. We work well together. I am so appreciative of that, and certainly to the leadership of Mayor Sarno. Thank you.
Thank you, Commissioner Carlton-Harris, very much. We'll now get the public safety update of this COVID-19 hospitals information, and I'll bring up the Commissioner, Fire Commissioner of the City of Springfield, Bernard B.J. Calvin.
Good morning, everybody. Thank you, Mayor. This week at the fire department, we have 6 people out with COVID or COVID-related symptoms. We have 1 positive case and 5 other members awaiting testing and their results to come back. On the safety front this week, again, I'm going to stress to everybody, be careful out on the ice. Be careful around waterways. You may think the ice is safe. It is not. If you get out there, you will possibly break through and fall in. Also, be careful if you're walking around the waterways. The ice can pull away from the bank, and you could slip under and get trapped under the ice that way as well. So everybody use extreme caution when you're out around the water. Stay off of the ice. Be safe. Play it safe. We've had some snow the last couple days, and we're going to get a little bit more. Everybody, please pay attention to the fire hydrants in your neighborhood. Make sure you get them shoveled out 3 feet around the hydrant so we can get connections on there if we have a fire in your neighborhood. That's all I've got for today. Thank you very much.
Thank you very much, Mr. Calvi. We'll now get an update pertaining to police, and representing Commissioner Cheryl Clapper this Monday morning is Deputy Chief Stephen Kent.
Good morning. We have 4 officers currently out, have tested positive for COVID. All 4 are recovering at home with mild symptoms.
It has been a quiet weekend in Springfield, probably attributable to the weather. And I would just remind everybody that we have a parking ban in place. We have another snowstorm coming tomorrow, and we will have crews out ticketing and towing so we can get the streets cleared. And that's all I have for today.
Thank you, Deputy Ken. We'll now get our update from Springfield Public Schools, and that'll come from the Superintendent of Springfield Public Schools, Daniel Warwick.
Thank you, Mayor. Good morning, everyone. So today, as the Mayor said, we're very proud of our team at the Springfield Public Schools and Sodexo, given how food insecurity has been an incredible issue during this pandemic. We're going to have provided 6 million meals for the families of our students here in Springfield, and incredible effort, 102,456 this weekend. And as of Friday, we were at 5,969,980. So that effort goes on. We have 18 sites in the city of Springfield, and that's gone very, very well. You know, as we continued our remote learning, we found a way to get the meals to our families. So I'm really proud of our staff. Talking about attempting to reopen schools, you know, this spring here, trying to get some of our students in March 15th, our high needs SPED, our SLIFE students, our ELL students, and some of our VOC students, and some of our regular groups coming back April 12th. So that would be pre-kindergarten, kindergarten, grades 1, 6, 9, and 12. So we're working on planning to do that now. And meeting with the union to conduct a complex set of negotiations to effectuate that occurring. While we're doing that, I've been working very, very closely with Pat Sullivan at Facilities and the mayor. And the mayor has put up $1.4 million to improve the HVAC systems in a lot of our buildings. And you know, a very complex piece because some of our buildings we're using were built in the 1800s. So a lot of complex work. We're really making tremendous progress on that. And that's going to help us in the future have healthier buildings for our students during flu season and so on. So that work is coming along very well. And we anticipate that being completed in all of our buildings prior to our kids coming back into school. Flu shots, just a reminder, again, for families to get the flu shots. We're not mandating them anymore, but we're strongly working with our health department, our health commissioner, encouraging people to get those flu shots. Winter sports, we've been able to restart the winter sports. And, you know, as our health commissioner said, who's been working with us since the beginning on the sports program, it's gone very, very well for our kids. And with 221 students and staff tested, 0 positive. So we've been able to keep the sports program going, and the next season we'll be talking about is what we call Fall 2, and football will be in that season. And given our track record, we're going to be bringing that forward to the school committee to take a look at. But with this testing that Helen helped us put in place, it's really been a nice precaution. And you know, our kids obviously are listening to their coaches, and they're not going to gatherings so they can stay eligible and play, knowing that tests are coming, and that's gone very, very well. So again, very, very thankful to our health commissioner, who's just been part of our team constantly on this, and my team, AD Dwayne Early and Lydia Martinez, and our nursing supervisor, Jean Clancy, for making that a success. Also very, very proud of our teachers. Our attendance has stayed at 92.1%. Almost incredible given what we faced since the beginning of the school year. So it's only 1.4% off our normal attendance. And it speaks to the teachers, counselors, principals at the schools, how they've reached out to families, kept everyone involved, and are doing an absolutely fabulous job during this remote learning time, making sure we make the best of that. And again, what helped us with all that is, again, the mayor's support stepping up to make sure we had the technology we needed. And again, all the technology and facility improvements have come out of the mayor's side of the budget. We have not laid off any employees, so we've been able to keep all of our teachers in place, our paras in place, so that we can provide quality services to our kids. So I'm very, very grateful for that. Thank you.
Thank you, Superintendent Warwick. I will now get an update pertaining to the Department of Public Works and Director Chris Signoli.
Mayor, thank you very much. With regard to COVID, the DPW has 2 employees out. Over the last week or so, we've had a couple of snowstorms, and I really have to thank my employees. Both of the events that we had, last night, as an example, started at 5 o'clock, finish at 6 o'clock in the morning, and then our employees go to work. They do their regular day. So it is not just working overtime, you're working 12 hours, then coming in and doing your 8-hour work. We are in an extremely snowy pattern right now. It looks like a 4-inch snowstorm for tomorrow, 4-inch snowstorm for Sunday. And the forecasts have been changing a lot, but it looks like we are in a very, very big snowy pattern right now. Traffic controller, as the mayor said, Union and Oak Street, it's the 6th one, I believe, since the end of the summer. These are very expensive and extremely time-consuming, so we will have that flat in flash and get it taken care of. I want to definitely thank the mayor and Helen. Our employees will be getting their 2nd dose of vaccines this week. There is also, because of the weather, been a big uptick in water main breaks around the city. While not under the purview of the DPW, we work with water and sewer on those to get those repaired. As Deputy Kent mentioned, ticketing and towing operations, the parking ban will remain on through today and through tomorrow, and we'll be doing a ticketing and towing operation. And we are also out ticketing individuals who plow into the public way. And in both of those, ticketing and towing of cars parked illegally and plowing into the public way, it's the same areas over and over and over and over. This year, there are certain locations that have received, we've done 3 storms, they've received 3 tickets. So we're trying to break that pattern with the people parking illegally and plowing into the public way. And that is it for the DPW. Thank you, Mayor.
Thank you, Director Signoli. We'll now get an update pertaining to Facilities and Parks Management Director Patrick Sullivan.
Thank you, Mayor. We have one out with COVID. Our schools continue to be on target for HVAC upgrades. At the request of Mayor Sarno, and with the news of the UK variant COVID possibly taking hold in the United States in mid-March, he requested an alternative way to collect taxes in the city of Springfield to ensure the safety of the residents and the employees of the collector's office. We worked with TJ Plant and his team and found that probably the best way to do that was to retrofit 3 windows on the ground floor. And we'll be working for the next 3 weeks to prepare that area. And I just want to thank the mayor for always trying to stay ahead of the curve and be prepared so we don't cause potential harm to either our residents or the employees. In non-COVID, residents in the McKnight, Old Hill, and Upper Hill neighborhoods, we'd love to plant a tree in your yard. We have a $1.5 million grant award. You can call 311 or 736-311, and the grant is from the Executive Office of Environmental Affairs, and we're proud to be administering this grant. I'd like to also thank Chris Signoli. For a number of years, we worked with Liz Stevens in the McKnight neighborhood on the McKnight Trail program. When we completed the planning process, his department took it over, and now they're working on funding for the 2nd phase of that project, so congratulations to Chris Signoli and his team on that. And then last, on ice safety, to echo Commissioner Calvi's request, please talk to your children. to stay off the ice. It is not safe. It's not going to be safe this year. The snow is insulated. We have underground streams. Heritage Pond in East Long Meadow is very different. It's an isolated body of water. Our lakes and ponds have streams. When you have running water that constantly erodes the underside of the ice, keeping it very thin. For residents that live along and abut Lake Massasoit, that lake has been drained, but there are still springs that operate. So again, the snow is covering those areas. It is not safe to walk on that snow because it's like quicksand with those underground springs. So stay off these bodies of water for the rest of the winter. Thank you.
Thank you, Director Sullivan. And as I always say, Springfield's in the business of doing business, and Chief Development Officer Tim Sheehan and his team have done a great job getting out the stabilization type grants and help, assistance to keep our businesses to be able to hang in there until we can move forward with our post-COVID-19 vision. Chief Development Officer, City of Springfield, Tim Sheehan.
Thank you, Mayor. As the Mayor indicated, there were a number of local businesses that received awards from Mass Growth Capital in terms of grants. We were very pleased to see that. We continue to monitor the Biden COVID relief package as it makes its way through Congress. As vaccines become more available to the public, it's a good time to take a look at the current economic indicators and what they suggest as we move forward. Just as the impacts of the virus have been uneven and inequitable impacts on communities and business sectors, we should prepare ourselves for an equally uneven economic recovery over the year to come. With some sectors snapping back quickly once customers leave quarantine, others that depend on face-to-face interactions, such as tourism, conventions, and entertainment, will take longer to return to pre-pandemic levels. Government at all levels must continue to support these sectors until they're ultimately stabilized. The good news is that the state's underlying economic numbers are encouraging. Economists suggest that the state's GDP is expected to return to pre-pandemic levels by 2021. As of third quarter, the state income levels are higher than they had been pre-pandemic. Unlike what we saw in the Great Recession, the price of homes has not plummeted. The state's median sale price rose 17% year over year in 2020. In December 2020, the median list price of homes in Springfield was $210,000, trending up 17% year over year. The median listing price per square foot was $128, and the median sale price was $210,000. Again, these numbers mask the unequal distribution of the suffering and setbacks that have been left in the pandemic's wake. Businesses that rely on face-to-face interaction have taken big hits to their bottom line. Employees of those businesses, many low-wage workers, have lost their jobs. It will take time to get these jobs back into our economy. Academic experts suggest that unemployment in Massachusetts will not fully recover until 2022, which further exacerbates the economic inequality within our community. While the numbers look good now, we must admit that some of the economic impacts of the pandemic are simply unknowable today because we have no previous history to guide us. This has been a recessionary period like no other in history, but we know what markets we need to be watching. Those include commercial real estate, healthcare hospitals, hospitality hotels, higher education, and restaurants. 4,000 restaurants have closed in Massachusetts. Outdoor dining will remain essential for those restaurants that have survived, and the city will remain committed to advancing that objective going forward. Thank you, Mayor.
Thank you very much, Director Sheehan, and I also want to thank City Solicitor Pakula and HR Labor Director Attorney Bill Mahoney and CAFO TJ Plant to give me their updates in our early morning cabinet head meetings, standard on that, and you were updated earlier in my presentation. With that, I'll open it up. Any questions or comments pertaining to my cabinet heads or myself? Okay, hearing none. Go ahead, Matt. Sure.
You mentioned the possibility of, if there was some supply of some of these smaller scale urban areas or as well. Is this part of some of those neighborhood vaccination sites that we discussed a couple of months ago? Is something we were hoping to when supply is a little more widespread?
Yes, the Facilities Department, headed by Patrick Sullivan, has given us a list of about 8 to 10 venues where we can stand up vaccination sites. And so we are ready to go, having done the work as far as making sure there was ventilation as well as parking and access to those buildings. So I'm grateful to Patrick Sullivan and Mayor Sarno for thinking again above the curve and trying to get us ready for our next steps.
Beyond the supply of the vaccine itself, is there anything else that you need in order to stand these facilities up?
Absolutely. So we hope to continue our partnership with AMR because they have been helping us with vaccinations. We are also working with local colleges and thinking about potentially nursing students as well as pharmacy students. They would need to be trained in intramuscular vaccination, but we believe that that should be fairly simplistic. But yes, we are looking forward to our partnership with AMR and partnering with some of our healthcare institutions, particularly our colleges in the area.
And this seems to be a possibility. We know that the Johnson & Johnson vaccine is going to be instantly plentiful, but it should be relatively soon, and I imagine that will a lot to expand availability. If supply wasn't an issue in itself, how quickly do you think you'd be able to stand these facilities up in an ideal supply?
In an ideal, it would take us 7 to 10 days, and that would mean we would need to put the staff in place, we would need to make sure the infrastructure was in place, we would need to make sure what that number of vaccines we will have so that we are not signing people up and disappointing them. And so logistically, there is information that we would need, but certainly I think Bowling School, it took us probably 7 to 10 days to stand that up, and I think that it would be the same. I should say I have not reviewed all of the sites. I'm comfortable because our facilities department has, and so prior to standing up a site, we would do a brief tour just to make sure logistically and we were ready and our infrastructure was concrete.
Well, while you're up there, just to follow up on that, have you had any indication from the state health department that they will be amenable to giving vaccines to do these neighborhood clinics? Because right now they seem focused on distributing to these large-scale sites. There are apparently going to be a couple more large-scale sites announced. Have they indicated that they are willing to work with the city on these neighborhood sites?
I am confident that the state will be willing to work with us. Right now, their focus, though, is to get as much vaccine into arms as possible, and they see the mass vaccination sites as that venue. You heard Dr. Kerouac talk about having done 50 at one of the health centers. And so there are some smaller initiatives happening, but right now I believe at the state level the focus is how quickly can we get vaccine in as many people's arms as possible quickly, and that becomes the mass vaccination sites. I should say I have heard from so many individuals who want to assist in setting up vaccination sites across the city. Those who work closely with communities of color, those who work closely with our outer belt communities and civic associations. So I think there is a lot of individuals wanting to work to stand up smaller vaccination sites.
Helen and team have done a great job. We're ready to roll, and I think we have a proven track record. I have voiced that to Governor Bacon, Lieutenant Governor Polito, about we'd like to get our hands on our own supply to do the vaccination sites. Helen's very important point she puts across. There must be a systematic approach of information being put out, deciphered, tracked, and communication to help individuals who need answers to certain questions or how to traverse a system. The other thing with the logistics of the areas we look at, depending on the continued new vaccines or current vaccines, is refrigeration. So with Pat Sullivan, we always make sure on a refrigeration site or there's a generator, God forbid, on backup. That is our goal, as we said we would do with testing, working with our valued partner AMR, and we've done it. That still is my goal and Helen's goal, to get into, we've looked at, I think, at 10 logistical sites throughout our neighborhoods in the city and try to do targeted vaccinations. Give me the supply, I have the team, well-tested team, to get it done. So I think, as Helen indicated, the Governor and Secretary Sutters, Lieutenant Governor Polito, their main thing is those mass vaccination sites right now. Get as much into people's arms as they can. I also think with President Biden and Vice President Kamala Harris, they're laser focused on this COVID-19. That's key. So they're going to continue to diplomatically twist arms to the entities that are making this vaccine, to produce these vaccines in a much quicker pace, and to look at new vaccines coming in. So give us the supply. We'll take care of our Springfield people as we always have and always will. Any other questions or comments? I want to thank, it's been almost a year since we've been doing these Monday briefings and cabinet head meetings. In the early days, I think I see all my cabinet heads shaking their heads. We were meeting every morning, sometimes on weekends too, on it, and I'm very thankful to them. We're getting there. There is progress. And I think the balancing of the testing and the vaccine coming out, being proactive in public health prevention methods is paying dividends. And I know it's been very aggravating and very frustrating, but you're part of the team. Each and every one of the viewers, listeners, the reading public of print publications, you're part of the team. And I deeply appreciate your continued efforts to work with us and your patience and understanding, as I do my cabinet heads all the way down to rank and file. I can't say it enough. Tested and true to a number of natural and man-made disasters. Next week, in the honoring President's Day, which is Monday, February 15th, we will not have our press briefing. We will have the press briefing Tuesday, February 16th, with Dr. Kerouac and Dr. Roos and all my city cabinet heads at that point in time. In the meantime, I wish each and every one of you and your families good health and encouragement. We will defeat this COVID-19. Now go out and have a great day, good health, and God bless. Thank you very much.